Please welcome to the stage founder of Patient Safety Movement Foundation, Chairman and CEO Massimo, Mr. Joe Kiani.
Good morning. It's great to be here with you. What a wonderful way to start the meeting yesterday, from Rich Cremona to the neonatal panel to the wonderful media panel we had, and of course Senator Barbara Boxer and the inspiring words she said. And I can't stop thinking about what she said. You save a life, you save the world. It's so true, and we're here with the 1 plus 601 lives saved. So thank you. Thank you. We have a pretty long day ahead of us today, but I think we're all pretty excited about what's coming, from the commitments we're going to hear about today to the panels on failure to rescue, medication errors, to getting a chance to see President Clinton again, and Sir Liam Donaldson, and then finishing up with the wonderfully talented and beautiful Alison Cross, which will be a tough match to follow, but I think she'll give it a shot, to the wonderful entertainment we had last night from McKenna Lee and the Microfixers. I want to just, on all our behalf, offer our condolences to the families that are here with us today that have lost a loved one, and the millions of families that are not here with us today that have lost loved ones. You know, if we don't make 0 by 2020 happen, we're going to lose millions and millions of more people. Even if 0 by 2020 happens, by 2020, that means we've lost about 2 million lives already. So I said yesterday, when you think about the numbers, you're unfortunately start thinking about numbers. You start thinking of statistic. And I ask you at this moment to put in your mind, put in your picture, a patient that you know of, that you know unfortunately is no longer with us here today. Have you imagined that face? When I think about it, I imagine faces like Emily, like Leah, like Rory. And these are the tragic faces of these preventable errors that occur in our hospitals. And it's supposed to be the safest place to go. And our Lenore, I don't know if she's here with us today. Unfortunately, she had a minor accident, and we had to make some changes. But when I was concerned about my kids going somewhere, she said, "Joe, don't worry. I sent my daughter to the safest place, and she got killed there. You can't get too worried." So I'm going to ask you, please, out of respect, to have a moment of silence for the people that we have lost. You're all here from all over the place. You're here from Brazil. You're here from Germany. You're here from Australia. You're here from Baltimore, Chicago, Boston. And some of you are even here from just a few streets over. And you've come because you want to get rid of this tragedy. And you are going to be the people that's going to get everybody else around you. I know there's been a lot of different organizations throughout the years that have put patient safety high on the pedestal, so that today we could be here to take it to the next level and to make it action-oriented. The research is done. We understand the causes. Last night, Barbara showed us the 9 most important causes. We have a lot of them covered. We're going to cover the rest next year. But we can do something about them. The success we have had in just 1 year tells us we can really get to 0 by 2020. The attention this has received from the people that make the biggest difference in our world, from you, the nurses, the doctors, the patient advocates, the policymakers. Let's me believe we're going to make a huge difference. You know, we're all giving up time to spend with our loved ones. We're giving time for other things we could do because we know there's no higher calling, nothing we can do together, nothing we can do individually that's more important. And this momentum we have started, we can build upon it. We can do it by continuing to unify our healthcare ecosystem. We can do it by identifying the challenges that are killing our families, our friends. And most importantly, not be afraid to say, what are we going to do about it? Yes, the solutions next year might be better than this year's, but we have the solutions that are good enough this year to do something about it. So these actionable solutions, these actionable patient safety solutions, we need to create them with your help, the people who know more about it than I ever will. I'm not on the front line, and I'm not here because I lost a loved one. I'm here like some of you because I felt that I had to also try to do something about it. And once we create these solutions, we have to get our hospitals to implement them. You know, last year when we created the 6 apps, we used to call them recipes, but worried about some people worrying about cookbook concept, we changed them to apps. We more than welcome other people coming up with their own solutions, different things, as long as they could measure the before and after. As an engineer, I've been trained to always measure before and after and always do a feedback loop to see how we can make things better. I remember Robin Betts from Intermountain Healthcare System, and one of the breaks said, we want to do something. Here's what we want to do. And it wasn't one of the apps we talked about then, and we were grateful for that. And we can't wait to share her story with you today. We need to promote transparency. Transparency is key. You know, none of us wake up wanting to hurt people, but sometimes we do. And we can't be ashamed of that because we're trying our best to do the right things. And you know, if people want to judge us, if they want to blame us, so what? So what? If there's one good thing about dying, is that you know you're going to die. And it really doesn't matter, right? So why not just do your best, give it your all, be all in. We also need to ask the medical technology industry to not hoard the data, hoping they're going to do something profitable with it, but rather share the data, hoping we can do something amazing for patients and combined do something profitable with it. There would be no successes like Google and Facebook if the internet didn't exist, if we didn't share data. And in our med tech industry, more than any other industry, we need to share data. And I'm indebted to the giants and the small entrepreneurial companies who have come forward and shared their data. I mean, for a Cerner to step up, where they could be easily in the catbird seat, it's huge. For Philips, GE, Draeger, who probably have 80-90% market share in patient monitoring and in anesthesia machines, for them to step up, it's huge. They could have easily just said, no, it's just for the little companies. I'm grateful to them. We're all grateful to them. I have a message hopefully tomorrow I'm going to read for you from Peter Pronovost, who unfortunately could not be with us here today. We had to either worry about his schedule or worry about President Clinton's schedule. And he agreed we should worry about President Clinton's schedule. But he does have a message that I'd like to read for you tomorrow. And we need to keep looking for misaligned incentives in our system and do our best to correct it. You know, no one's perfect, and therefore our government is not perfect anywhere in the world. Yet, we have to keep trying to make our government better. And there are a lot of misaligned incentives out there that the government policies can help fix. And last but not least, we have to promote love and patient dignity. I know there are people in the audience, like people that I admire, like Dr. Mike Ramsey, who, because he has so much love in him, he already takes the love to his work. He says, no, we need technology. And I've said to Mike, yeah, we need love and technology. And we do. I met recently with the chief nursing officer and chief quality officer of UPMC, Tammy. And she's asked me a trick question, I thought, later. She said, why do patients go to hospitals? And I guessed wrong. And she said, because of nursing care. They could, after surgery, go home. But they go to hospitals because of nursing care. And nurses only spend a fraction, a very small fraction of their day watching the patients. If we can get them to spend the majority of time watching their patients through processes and technology improvements, that love that they can give to the patient is better than any technology we can create. At last year's summit, we brought forward 6 apps. Collectively, through our steering committee, it's the stuff we knew. We had a mid-year meeting, and we had more wonderful people come to that meeting with their love, with their care, and most importantly, and thank God we had the Joint Commission come, and they showed us things that are causing even bigger problems. And they've spent years trying to figure out why, trying to refine it, trying to improve it, and they have incredible examples how it has worked. We're happy, we're glad that they're sharing those today here with you, tomorrow to be exact, and I think they're going to have a huge ramification. While we are prepared, and it's probably the right way to do it, to do this one hospital and one med technology company at a time. Because at the end of the day, it's the culture that has to change. And no one can tell you what to do, but if the culture changes, and yet you have somebody else creating some laws that creates incentives and disincentives so that you can pull your peers by their collar faster, we can move this thing faster. So we have also asked the government of the United States to help. We hope in the future, through the work of others, we can ask the governments of other nations to help. We've gone to CMS, Center for Medicare and Medicaid Services, and we've asked for their help. They've already been doing some amazing work. They've created the Partnership for Patients, which now has 3,700 members. They made 2 goals their objective, and they had a great timeline. They looked at 2010 to 2013, and they wanted to see a 40% reduction in healthcare-associated infections. They wanted to see a 20% reduction in readmission. And we brought one of our apps in front of them at the beginning of this year, which is Failure to Rescue. And I am just blown away by how Dr. Patrick Conway accepted it, knew it from inside, and drove it. And they're driving now that particular apps to become something that the surveyors look for, which means you're gonna soon have wind in your sails. We're hoping that they'll take on the other apps that we're creating and ask our surveyors to look for those processes. We also asked elected officials to step in and help. We had a couple of amazing meetings with with Vice President Biden. I keep thinking about his wife, Dr. Biden. But Vice President Biden, at our first meeting, said, he really practically fell off his chair. He could not believe the numbers that we're talking about. He asked for another meeting, 2-hour meeting. I mean, these guys are busy. 2-hour meeting for us to educate him further on it. Dr. Ramsey, who's on the board of the Patient Safety Movement Foundation, Lenore, a couple other folks, and I went and visited them. We've met with numerous senators, from Senator Boxer, Senator Casey, Senator Hatch, Senator Harkin, and we educated them on this issue. Senator Harkin held the first of its kind patient safety Senate hearing where we testified and a lot of other amazing folks, more amazing than us, testified, like Dr. Patrick Conway. And they are looking at introducing legislations. And I'm going to tell you some of the things we recommended to them. And doesn't mean these recommendations are the best ideas, but it'll start the dialogue and maybe better ideas will come out. Number one, create transparency. The media panel talked about it. Jim Messina and the media panel yesterday talked about it. Look, for far less important matters like how we're going to invest our money, we have the Security Exchange Commission that allows, potentially, it's written in a way that allows my mom to be able to read it and decide whether she wants to invest in Massimo or Google. Right? I mean, it doesn't matter how wonderful the management team of Google or Massimo might be, we put it down to variables that mean something financially. And yes, people can cheat, but there's audits. There are ways to try to minimize that. But for the most part, I can tell you, these companies, especially, and this doesn't mean to be self-promoting, especially the leadership of these companies, did not get there because they couldn't wait to go swindle people. They got there because they were the best, the most ethical people in their organizations. And they do want to do the right thing. So what's the difference with hospitals? I mean, look, hospitals are even more like that. We can all be in different businesses. We could be making toys. We could be making guns. We have made a business of patient care. Whether you decided to go into nursing, into engineering, into being a physician, it's the business of patient care. So why not have the transparency? Why not create a patient exchange commission where hospitals report the exact same variables, same type of data, and maybe even physicians' track records? That transparency will lead to competing for the right measures. We've asked them to provide incentives and disincentives to help spur CEOs like me waking up every day in the hospitals and saying, what are we doing about patient safety? So what did we ask for? We said, look, if you take your automobile in for whatever, tune-up, a service, and the next morning they say, I'm sorry, the automobile caught on fire last night, they don't charge you for what you took it in, for the tune-up. In fact, they usually replace your automobile. We unfortunately take our loved ones into hospitals, and if they get killed by a preventable reason, Medicare or insurers still get billed for the reason they went in. Now, I know I'm talking a little about sensitive material, but what if when somebody dies from a potentially preventable cause, that payment is held until they understand, did the hospital have the right processes to try to prevent that? And if they did, pay it. And by the way, also shield them from litigation. But if they haven't, then don't pay it. Imagine the incentive it creates for hospitals to make sure they're doing everything they can to prevent patient harm. Create the patient data superhighway. There was $1 billion given to start this EHR world. And multiple hospitals benefited from that. Multiple companies benefited from that more than the hospitals did. I believe last year $800 billion was spent on health information technology. Yet, some of these companies are not sharing their data. They're not making it the patient's data. So why not have the ONC who watches that withhold payments for companies that do that, for the ones that are guarding the data? Promote patient dignity. We asked them to ask hospitals to have a patient advocate at every hospital, that when the patient's family is checking in, they get their number, they know who to call if they feel they're not getting the right attention, they're not getting the right care, and they're not getting the right level of dignity. And they come in right away to stop it. And last but not least, we told them, be sure that innovation in healthcare is not only unimpeded, but it is promoted in every bill they produce. Because look, guys, as much as we've made advancements, we have so much longer to go. And to stop here and think we've done, and technology is the enemy, and innovation is the enemy, It's like when DEC co-founder said he can't see a personal computer in people's homes. Didn't do much for DEC. It wouldn't have done much for us if we'd listened to that vision. We're hopeful that indeed the government will help us move faster. But at the end of the day, it's up to us. It's how committed we are as individuals in each hospital, how much love we're going to give to what we do that's going to dictate what's going to happen. It's not that complicated. This is what Mother Teresa said about that. I am not sure exactly what heaven will be like, but I know that when we die and it comes time for God to judge us, He will not ask, how many good things have you done in your life? Rather, He will ask, how much love did you put into what you did? But to make that happen, we have to take responsibility, we have to lead, and we have to be assertive. We can't delegate this to other people. And by assertive, I'm not saying go scream and shout at your colleagues. That will actually have the opposite effect. Next year, we're going to bring a panel in about how to be assertive in the right way. There's some research done that's incredible about that Dr. Bill Peruzzi turned me on to that I want to share with you. But we want you to learn the facts. We want you to walk in with the apps. We want you to have conviction in them. And we want you to whisper and repeat yourself to your colleagues until they follow you. Look, nurses and physicians, your profession is at risk because patients are at risk. Your profession is at risk because of Affordable Care Act. Let's not be shy about it. There's a lot of good things about it, but there's also just some threats about it. Look, we have a chance to be counted. You, more than anyone, have a chance to assert yourself, not for yourself, but for patient safety. And by doing that, you assert your role in this very important ecosystem. Look, Affordable Care Act has a lot of potential. It incentivizes hospitals to take full responsibility of patients through the Accountable Care Organization. But it's also a capitation system. I mean, some of us know what happened to capitation in dentistry. It was not good for dentists, and it was not good for patients' teeth. Anybody from England here? Do I make a crack? But, just kidding. But if we assert ourselves, if you assert yourselves, if you don't let other people make important decisions for what impacts your patients, then that won't happen here. And we can get the best of the Affordable Care Act to be what we have here. If we're going to go from 601 plus 1 life saved to 6,019 plus 1 life saved, we need to scale this thing up. We need to be pushy. We need to be persistent. Dr. Cremona stated yesterday that in the past 100 years, life expectancy is nearly doubled. Yet, as Senator Boxer said, we're losing still to cancer, we're losing still to heart disease, and number 3 is preventable causes that kill people at hospitals. We can do something about that today. Our children shouldn't die anymore because of that. So please, lead and be assertive. Give it your all. And just to bring some bipartisanship in here, I will paraphrase something Ronald Reagan said. There is no limit to what a man can do or where he can go if he doesn't mind who gets the credit. You know, every one of us in our own world, we've already done what we needed to do. We are who we are. It doesn't matter what people say we are those people. So it's not about that anymore. It's about uniting together, not worrying about the credit, and just worrying about patient safety. Make that the only reason you're here. Make that the only reason you're being assertive at your hospital. And by doing that, we'll get to zero by 2020, and we will also ignite our souls.